So I am going to approach this healthier food environments from a Queensland perspective. And I better get my clicker. Food systems around the world are in crisis. So whether you agree, whether you disagree with this statement or haven't even really thought about it, it is increasingly becoming difficult to ignore. The dietary patterns being fostered by food systems are responsible for 1/3 of global greenhouse gas emissions and approximately 70% of freshwater usage, as well as being the primary drivers of biodiversity loss. Modelling indicates that dietary consumption patterns alone could add nearly 1 degree Celsius to global warming by the end of the century. We have all experienced the disruption that natural disasters and more recently COVID-19 have dealt to the supply of our usual foods. Whether you've had difficulty sourcing your usual ingredients and prepared food offerings for your outlet, or have noticed that the many gaps on our supermarket shelves, we have all experienced a significant impost on our food systems. And it's becoming increasingly obvious that we need to change the way we eat and how we source our food. Less and local. The Health of Queenslanders report from the Chief Health Officer released in April this year has some sobering statistics, which are up on the screen. These are staggering numbers that hide the everyday people they represent: ourselves, our families, our neighbours, friends, our work colleagues. This has seen an increased impost on our hospital systems and our community health providers such as GPs. Dietary risks combined are a significant contribution to health loss and account for nearly 10% of deaths in Australia in 2020. There has been a lot of media noise about the increase in mental health disorders, especially over COVID, and these are affecting all age groups in our communities. Just under half of Australians will suffer from a mental health disorder over their lifetime. There is an increasing amount of evidence that what we put in our guts impacts the type of microbes that live in our intestines, and the byproducts of these microbes release into our bodies when digesting the food in our guts. These byproducts have impacts on our brain and other parts of our bodies as well, potentially for good or not so good, depending on the type of bacteria that we have living in our intestines. A bit scary, that thought, isn't it? Think of your gut as a garden. Fertilise, water it with the right stuff, and you will reap a garden of flowers and vegetables, if not possibly a garden of weeds or sick and dying plants. We know from several studies published by the Food and Mood Centre at Deakin University that people who eat more unprocessed foods and have more fruit and vegetables, whole grain cereals, use poly and monounsaturated fats, eat more fish and chicken than red meat, have better outcomes for mental health. And this applies to all age groups. So given how stressful working in the health and education system has been over the last 3 years and continues to be, it makes sense to support our workers and our children with the right food to support their mental health. While healthy eating has been a driver for many initiatives in health policy and direction over the years, personally, I have been involved in 4 of these spanning nearly 20 years. The first was a joint Department of Health, Department of Education initiative, the School Tuckshop project, which involved leveraging food producers to improve the health value of their food products, including lowering salt and sugar and in manufactured foods and replacing saturated and trans fats with unsaturated fats. My own children's school tuckshop was used as an exemplar of how changing to all healthy foods could still turn a profit. We also organised the first Tuckshop Expo and were pivotal in establishing QWOST, of which, as it was said, I was the first president. These initiatives are still running and have gained traction and made significant inroads into transforming children's food choices. I was also part of the first iteration of A Better Choice in Queensland Health in 2007, with 2 years funding for a project officer to try to drive change to retail, vending and catering. Natalie Oberski, the first ABC projects officer, and I toured Queensland, meeting with staff, retail managers, food services and executives to run workshops and spread the message, support change and enable a healthier food supply. I have also seen significant change in our facilities with respect to menus for our hospital inpatients and aged care residents. I led the development and implementation of nutrition standards for meals and menus that have been integral in changing the nutritional quality and improving choice for our consumers in Queensland health settings. And while we promote high protein, high energy menu choices for our residents in aged care and sick patients in acute hospitals, we also acknowledge the importance of having lower fat, salt and sugar options for our longer stay younger residents in mental health and acquired brain injury units. And by extension, support access to healthy food options in hospital event catering and our retail outlets in our healthcare facilities, both to support our staff being able to access healthy food options easily, but also as an example to our visitors and more ambulatory patients that healthy food can be tasty and enjoyable. A recent Australian study of 75 mental health inpatients indicated that half consumed food that was from external sources, and those that did, the impact on total kilojoule intake was significant. This confirms to me the importance of having healthy options in our retail settings in healthcare for our longer stay, younger ambulatory patients, such as in acute mental health units, and also our day patients that we don't feed actually in a hospital bed. And most recently, I've been heading up Statewide Foodservices for Queensland Health, the unit that hosts the Queensland Health A Better Choice Statewide Project Officer, Brooke Maund. And I have worked with this round of ABC, firstly with the Preventative Health Unit and now with its transition to Health and Wellbeing Queensland. Health facilities are an obvious place to highlight and model health promoting environment and behaviours. The Healthier Food and Drinks at Healthcare Facilities Health Service Directive, introduced in 2020, mandates implementation and reporting of a better choice and states the healthcare providers have a responsibility to lead the way in modelling environments that support healthier choices. I have seen firsthand how change happens. It is incremental and is usually met with resistance. But over time, I have seen improvements in our food supply, in health, in schools, at the supermarket, and even in the takeaway sector. And we are so lucky here in Australia to have access to an extensive variety of fresh food and cuisines with growing acknowledgement of local Australian native foods, which are increasingly making their way into our food supply as healthy, tasty, and environmentally friendly additions to our enjoyment of eating. So returning to my first jarring statement, world food systems are in crisis. How do we positively contribute to implementing and maintaining healthy food environments in our community? Firstly, by understanding what a healthy, sustainable food environment is. And this definition on the screen from the Food and Agricultural Organisation of the United Nations is an excellent one, covering all aspects of healthy food environments. Being aware of where the food we order comes from. Is it sustainably farmed, manufactured, packaged and transported? Being aware of what is in the food we order. Is it nutritionally okay for our customers? The ABC guidelines certainly help here. Being aware of how to best market the healthier food options so they compete successfully with less healthy options, making healthier choices easier. So, in your positions of influence in this space, I would encourage you to make a better choice by aligning menus with sustainable, healthy food options, buying products that meet green and amber guidelines and where possible are locally sourced and produced, and caring about making a difference to the health and well-being of those in your local community and supporting your local food suppliers. Thank you.
Thanks so much. Thanks very much to Health and Wellbeing Queensland for inviting me today. It's a real pleasure. This is a real passion project of mine. So can I also just ask that someone wave at me when I get close to time, because I might go over because I get very excited. And I guess just listening to, even the introductions, so it's an area that I've been researching for a long time, which I'll talk about in a moment. Just working out my clicker. So I'm just going to put that up. And I guess just to let you know, I come at this from different perspectives. So I'm a public health researcher, and I really would say that my work has been dedicated to trying to provide evidence with the right partners to implement policy and practice across health that makes for more equitable health outcomes. And over the last 10 years, there's been a really strong focus on the food retail environment as a mechanism for doing that. And I guess I'm really excited that there's so many people in the same room who share the mission of trying to make food environments more health enabling. And I think I would just really echo that. I'll probably say all this in 20 minutes now, but I guess what I've learnt over the years is actually it really is all about putting the tools, the resources and the evidence that makes sense to those who have to implement these policies and practices in the hands of those who have to implement. And that's obviously you and your partners. And I think that is the biggest lesson, and that's why expos like this are so important, because it's all about making it implementable, I would say. So I want to start with a little bit of a backward step to why are we all here in the first place. And I guess the global context is that currently diet is the greatest modifiable risk factor for chronic disease in the world and in Australia. So if we were going to be focused on something, I'd say you're all focused on the right thing. If we can make a change in people's diets, we can have huge dividends in terms of health, quality of life, and improving equality in health outcomes in Australia and globally. And I guess, you all know this, but I think it's important to reflect again on why we're here. Unhealthy diets lead to a number of different sorts of health outcomes that are adverse for people. And this leads to chronic disease, it leads to premature mortality, it affects quality of life, but it also affects things like productivity and leads to lifelong inequalities in people's life outcomes. You may not be able to see the detail in this, and I did just notice this morning that the two light blue and dark blue boxes are in the wrong circles, but the point of this is really to say that this is not an easy fix. We know that if we're going to improve population diets, we have to do a number of things that complement each other at the same time. We have to be able to support people throughout their life course with better, healthier options, and we need to do that both through education, which is kind of this central interpersonal factors. We need to really focus on things like interpersonal factors. So how do you think about somebody's community or their family environment? Where we're really focused today is the next kind of level out, the settings or the meso level. So how do we really think about enabling environments at a settings level? But then you also need much higher level, strong government policy. And I guess I just want to make the point that I think while we're rightly focused on food environments for reasons I'll touch on in a moment, it can't happen in isolation. You absolutely at the same time need education and you need strong government policy. So, excuse me, why do I think we need to focus on food environments? So one of the things that we really notice, so we do a lot of research in the space of improving population nutrition from individual level to population level. And one of the things that we noticed was this big red circle in the middle there. There wasn't a lot of focus on evidence for how you might change the food retail environment. And that might be in lots of different contexts. So today we're focused really on things like health services and sport and recreation settings, but it could also be in the shopping strip or the shopping centre. And it became really clear that actually it would be really good to start to focus on what is the evidence that we need to support food retail to shift to being much healthier, because there isn't a lot of evidence in that space. And as you can see from that diagram, they really are in a gatekeeping role. They're really quite linked to the producer, the supply side of the system, and they're extremely linked to the consumer or the demand side of the system. And so while we've sort of got a lot of focus on those two ends, we didn't have a lot of focus internationally actually on that food retail setting. And so I think there are a number of reasons to have that focus. As I've said, one of them is that they really are that kind of gatekeeper to a healthier diet. And one of the things that I'm not going to touch on so much, but I think you will all recognise, is that often the food retailers start to build up this huge rapport with their community. And so I think the more that you can really drive that virtuous cycle of doing things because it's good for the community and the community feeds back that therefore they like the food retailer, that's actually a virtuous cycle that I've seen happen in a number of instances that perhaps we don't leverage enough. The other reason I think we really need to focus on the food retail setting is because they do have a number of levers at their disposal. So I'm not a marketer, but I've learned a lot about food marketing over the last 10 years. And you know, those principles of price, placement, promotion, they are really things that the retailer themselves can have a lot of control over, or some opportunity to leverage with the suppliers. And I guess the right-hand circle really speaks to kind of why I got into this space. I was really interested to know, well, can we build some evidence that moving to healthier food retail can be sort of win-win-win? Can it be good for the community and the consumer? Can it be good for health in general? And can it actually be something that we can make work for the retailers? And we started to build a number of small case studies demonstrating that that might be the case. And I'm going to touch on some of those. One of the things I did want to mention, because I think, again, sort of stepping back is really important, it's really a great time to be doing this. So obviously, there's a lot of, sorry, I've got a scratchy throat. There's a lot of momentum clearly happening here in this room, in this state, and with the possibilities enabled by Health and Wellbeing Queensland to build on the work that's happened with many of the people in your exhibition spaces today. But we also have a national preventive health strategy that really calls out the importance of these enabling environments to promote health and wellbeing, particularly for our children. And so I would say that, you know, while we're still waiting really for the implementation strategy to support the preventive health strategy at a national level, this is a really good time to be linking in with all your activities to what the federal government wants to do and what their aims are, and just kind of calling out how your activities are naturally delivering on their strategy. And I think that might be quite a good area to focus. So I do want to focus a bit more on some of the things that we've learnt through our different partnerships with different organisations who really have been leaders in this space. Most of my examples, but not all, come from Victoria, but really the learnings are pretty much what you will have experienced, I think, in all your different partnerships. You know, what is it that is going to take to make us move forward at scale? So one of the first studies we did, which many of you might know about already, was with Alfred Health. And the reason I wanted to touch on this was because it really, I think, highlights a number of the principles of successful change. So in Victoria, there's a similar kind of framework to the Better Choices. Has slightly different percentages and colours, but essentially it's the same idea. And so Alfred Health, which is a major metropolitan hospital in Victoria, was really keen to try and meet those targets. And so the hospital was talking to its different retail outlets, and one of the retail outlets was really quite concerned about having to make any changes to any availability, and were very concerned about taking choice away from consumers, and so we're not very keen to do anything. And so we were also very interested, because things were starting to change, to try and build evaluations into any implementation changes that might happen. So the hospital, the retailer and us, we kept having conversations about what they might be comfortable to do. And finally the retailer said, well, you know what we would do? We could take all the red drinks out of the fridge that's free for the customer to choose from and put them behind the counter where no one can see them, but they're still available. So we're not removing choice, we're just kind of changing what's in the fridge. And we said, well, it sounds like a good idea, why don't we try that? And they said, sure, but you know, there'll be no effect, like you won't get what you want, but we'll give it a go. And so it was one of those really funny things as a researcher where I spent weekdays going in and standing on tippy toes to count how many different drinks were on which shelf. And I was like, this is surely not what I've got expertise in. But I learnt a lot. And, you know, we got to talk to the customers and we got to talk to people stacking the fridges. And what was really interesting was actually it had a huge effect. So the retailer was really happy because they hadn't taken choice away. But if you compare the left-hand and the right-hand bar, you can see that the sales of red drinks went down to almost nothing. And that was simply because the people went to the fridge, they found something they were happy with, they bought the thing they were happy with. The other thing you can see is that there's almost no change in the total height of the two bars. So the number of drinks sold essentially stayed the same. So the retailer was really happy, and obviously it's not all about keeping the retailer happy, but in some circumstances I think that's an important consideration. And so the retailer was happy because they managed to sell the same number of drinks. The customers were happy because they found drinks they wanted to sell. And the government was happy because the number of green drinks and amber drinks increased and the number of red drinks decreased. And what was kind of interesting about that was I mean, it was a good intervention, but actually it was a gateway to further discussions and further engagement around this issue, because suddenly everybody saw possibilities where previously they'd only seen barriers. And so one of the things that Alfred Health did then was a series of other trials, and I'm going to put a whole lot of these sorts of flyers up more as indications of things that have happened and resources that you're free, I'll circulate these, that you're free to access. I won't go through the detail. But one of the things that happened was Alfred Health put this flyer together with our support, and we did a number of other trials with them, and the retailers in other parts of the health service got quite excited to do different trials. So we did a range of different trials where we did things like change placement, move fried foods out of sight or not until like only cooked on order, increase pricing of unhealthy drinks, decrease pricing of healthy drinks, all these sorts of things. And it became this fantastic little ecosystem where the retailers and their customers kept coming up with new ideas of things to trial. And so then suddenly the energy moved and all the ideas started coming from the retailers and the customers. The hospital was the auspicing organisation and we were there to measure everything. And I have to say, it was one of the funnest things I ever did. It was such a great energy and such a great environment. And then the learnings from this, and obviously not completely applicable to every other context, but the learnings from this really drove a lot of change, one of which I'm going to show you in a moment, across other organisations, because suddenly things started to look feasible, which hadn't looked feasible previously. So some of the things that we learnt across all the different studies we did, and that I'm going to pull out of some studies I'll show you in a moment, that really I think are some of the principles for how you might co-design, co-implement, drive change in the sort of partnerships that you're all working in, are really, one of them's around that engagement that I'm talking about. So what are the avenues that we've got to think about how we might engage different stakeholders to design these new interventions? And that's obviously for kind of reasons that are really true to co-design, because it's more likely to come up with ideas that are going to be effective because people know the context, but actually it's also just really important in terms of engagement, as I've indicated, and kind of breaking down those things that look kind of impossible to manage. The other thing I think that we probably could do a much better job of in general is synthesise evidence on what works. So there's a lot of instances where we're all reinventing the wheel, but there's so much understanding out there of things that have worked in different contexts, and that's something we're working quite hard to do, and I'll show you that soon. But I think it's something, you know, would be really good to use this kind of collective for, and that's why these kind of exhibitions I think are so important, because here you get to talk to people who've identified what works in their context, which might work in yours, but also the challenges that you might be able to help solve. The third one there is something that I'm going to show again a bit more about, but we found was really important, that if you're going to drive change and you are going to gather evidence, it's great if you can gather evidence that's relevant to the people who you're asking to make the changes. And so we, again, coming from a health background, we're very good at collecting health outcome evidence, but we became really good at collecting evidence of business outcomes as well, which I'm going to show you in a minute, and I would advocate for that. And then something I'm going to talk about at the very end is, you know, assuming we can all make all the fantastic changes we want to, how do we think about sustaining those? So sometimes we have an intensive, say, dietitian support as a resource to make a change. If that's not sustainable in the long term, how do we make sure we can sustain these changes so we're not just back here again in 10 years talking about it again? So one of the things we did 5 years ago was we put up a bid to the national research funding body, the National Health and Medical Research Council, and we got money for a substantial centre of excellence in food retail environments for health. And so it was 5 years, and we managed to draw together a dozen different academic and non-academic institutions across Australia and a couple internationally to really look at, can we pull together some of the best possible evidence on what works in changing food retail across different settings. One of the things we learnt from this is, as I was saying, that even if we developed all this evidence, actually it's an art in and of itself to try and communicate that evidence to where it's needed. So we also created something we've called the Nourish Network, which is really a network trying to create more interfaces between researchers, policymakers, but then the health promotion practitioners. And so that's an area, and I'll come back to it at the end, but if you're interested, you know, we'd love to hear your insights and your expertise about making changes in your context. So I just want to touch on a couple of key things that we've learned that might be useful for your future discussions. In terms of, you know, how do we start to actually build evidence of business outcomes that might be relevant to continuing to engage and support the food retailers to implement these? Some of the things that we found were really important from the literature, and then we've started to implement in all our studies that really support, more greater uptake of change are things like sales, obviously, so what's happening to the number of items sold, the volume of drinks sold, the dollars sold, so sales are important. Revenue is also really important, so some things have a greater profit margin, again, another area of huge learning for me that most of you will probably have much greater expertise in. But there are lots of data that the retailer themselves looks at a day-by-day basis, but perhaps doesn't have an overall sense of when I made that change, did it actually lead to an increase or decrease in revenue? The other thing that has been really useful in working with retailers on revenue is they are obviously the experts in trying to understand, well, even if I am going to make a small revenue loss on that change, where might I make that up? Maybe it's by promoting some other healthy option that I haven't really promoted heavily before. So harnessing their expertise in consumer marketing behaviour, we have found is a really good way to then target that revenue. Patronage is clearly important, so do the consumers keep coming back? And one of the areas that we found really quite interesting that hadn't been explored, there was a lot of kind of challenge identified around, well, if we shift and get rid of all the pie and chips kind of idea, we're going to lose all these customers. And so we said, well, we can measure that for you, but also you might get other customers. So we did a lot of work, which I'll show you in a moment, with YMCA. And we had also heard through our surveys a lot of parents saying, well, actually, we would go to the CAF if it was healthier. Right now, we avoid the CAF because we don't want to have to say no to our children. And so that was a whole area of customer patronage that actually hadn't been explored with these retailers before. They were kind of just seeing the potential loss, not the potential new customers and the potential gain. And so again, being able to measure that has become really important in our engagement and in their sustainability. And then obviously satisfaction. So some of the cafes that we work with ended up putting in, the little iPads with the little smiley faces. You just have to touch one smiley face as you leave. And they were rapt because they put these little iPads in, they made their changes, and actually some of them showed better satisfaction, some of them showed no change, but otherwise they really wouldn't have had a radar. So some of the communities have a really good engagement with their customers and they know immediately whether the customers are happy or not. But for others, there are small things like that might be worth considering. So I just want to show you a couple of examples. As I said, I'm not going to go into the detail, but it really is to show that these are settings where successful change has happened, and if you want more detail on the specifics of the changes that were made or how they were made or how we measured the data, then absolutely feel free to follow up. So at Deakin, we had a big change piece, which took many, many, many years, I would say, and really was focused on trying to meet, again, our state government targets. And it was seen as a big challenge by the university, particularly because they had students and they didn't want to disappoint the students. But again, by trying to reframe it as something that they owned, so they ended up coming up with what they called the Deakin Food Charter, which addressed other issues from their perspective, like taste and affordability for students, but at the same time addressed the Victorian Healthy Choices Guidelines, but by framing it in a way that actually made sense to the university and its students. They were very happy then to drive that charter. And we've seen amazing changes. So they're meeting the targets. So again, reducing sugary drinks, reducing sugar sold, and that's quite sustainable because it's led to changes to contract management at the university level. So some really interesting sort of tips and tricks. I think if you can write it into your contracts, that's another way to drive change. As I said, we did a lot of work with the YMCA in Victoria, so they were really keen to introduce a healthy food and drink policy. It was a really strong policy. We went further than the state government's policy in terms of reducing red, increasing green. And so we evaluated it over 6 years with them, got all their sales data, did lots of customer surveys, and we've published some of it and some of it's in process, so just this I would ask you not to share because it's not accepted yet. But what we did find, so we looked at the food and the drinks separately. In terms of food, there was no change in the proportion of green food sold, which I think is kind of interesting and important to note. But there was a switch from red food to amber food. So they saw the changes they were looking for, but not to the level they wanted of green. So their takeaways for this are, well, this is a good step, but now we really need to think about how do we provide green food and market green food that's going to be more likely to be purchased by our customers. In terms of drinks, they saw a large increase in green drinks, like much more than they expected. And this was interesting because they also increased water bubblers, so free water provision. So in addition to free water provision, they also saw a large increase in green drinks purchased and a large decrease in red drinks purchased. And they were extremely happy with that. Some of the other things that they observed, again, which were both supportive of the sustained change but learnings, so they saw no change to food revenue, which surprised them and was a real positive for them, so no loss in food revenue. There was a decline in the beverage revenue, and they think, and I think it's probably true, part of that is the greater supply of free bubbled water. They're not concerned by this, so I guess that's the other thing to think about for something like the YMCA, which has a big revenue base. A small drop in drinks revenue may not be a big deal if you can support the cafes. So there are different ways to think about changes in revenue, but that's definitely a learning for them. And certainly customers were overwhelmingly supportive. So I'm just going to touch on a couple more examples and then I'm going to wrap up for questions. This one is led by someone called Julie Brimblecombe joint through the Menzies and also Monash University. You might have heard about it. If you haven't, I think it's a really good one to look up. Sorry. Because again, this really demonstrates, I think, the success of a true engagement and co-design process. So this was through a number of Indigenous stores. So it's led by the corporation, the Aboriginal Land and Store Corporation Management. They were the ones who wanted to drive healthier food provision for their communities and with their communities. The communities really wanted to drive it. So it was actually driven by the communities and the store corporation. And then they worked with and had a long-standing relationship with this research team who gave suggestions on what might you do. So, for example, it was things like taking out the really large sugary drink bottles from the fridge, still available on the shelf, but taken out from the fridge, so not cold, reducing shelf space for high sugar elements. And again, they saw really positive outcomes, so a really large decrease in sales of particularly those sugary drinks and also some of the sugary confectionery. So they also took confectionery away from the checkouts. So they trialled a number of different interventions across a number of different stores, and the communities were very supportive and the store management is very supportive, and so that's now being implemented as usual practice, and other store management corporations are now picking this up as well, and there's a lot of discussion with government about how they might be able to better support and enable. So I think it's another really good example. Again, as I said, if you want to look at the processes or the actual interventions or the outcomes as an example of something that can be successful, there's a lot of good material that I can share. The last one I want to mention is we've actually realised that a lot of this is about tools and resources. And so one of the things that came up through the network I was telling you about from some of the retailers involved was, well, that's all well and good, and it's great that, you know, there are people in this network who've managed to make the Victorian government changes in their health services. I actually don't know how to do it though. Like in my context, I do not know what is step one, what is step two. I just can't even take the first step. And so we harnessed what in Victoria is kind of the Healthy Eating Advisory Service, so they provide support for some of these changes, and some of the retailers who'd made the changes in their own health services and sport and rec and university settings. And together they put together this toolkit, which really is like a step one, do this, step two, do this, step three, here's a resource for you, step four, you can talk to this person, and has been really, I think, well received by the retailers and the health promotion practitioners and dietitians in the health services trying to support these changes. And one of the things that's been great is we've now got a small research grant to do a partnership project with Health and Wellbeing Queensland to adapt that toolkit to this context. So we are working with many of you to actually see if it works once we've adapted it to this context and how it works and what else might be needed. So we're really keen to collaboratively build out tools and resources that actually make sense to those implementing these changes. So I just want to finish by some final reflections. I think one of the kind of final reflections that I think is important to keep in mind is, you know, what are the other things that we can do to make these changes actually feasible and to kind of reduce the barrier to change. And one of them, and that's why I started with that example of moving the red drinks out of sight, is to try and find changes that actually might feel feasible, like small bites, really, in the first instance to someone making the change. I think to sort of say, oh, there's all this we have to do together is really daunting, whereas I think if you can say, let's try one thing first, let's, you know, do a temperature test of the customers and have a look at if it's working in terms of people buying healthier food, and then let's do the next thing. In all our studies, we've found that that kind of small bites approach really makes a difference. When you notice customers switching to healthier options, whether that's through their observations or through your kind of looking at the evidence, really strongly communicating that back has been critical, I think. To see the customer satisfaction and to see the customer purchasing is really what drives the change. And then obviously there's support to try and analyse the sales data in a way that makes sense of the changes that are being made. And then finally, thinking about, well, how do we sustain? And I won't go through all this, and a lot of this will probably be quite intuitive to you, I would imagine, but I think it's really important to think about what does that look like in practice then. So once we've made these changes, sadly I've seen a lot of examples where changes have been made and then the support is withdrawn or the leadership, interest goes, and then the changes just go back. So I think while you're in this period of kind of exciting change, it's really good to start to think about what are things we need to put in place, and this captures a number of them, to make sure that any changes that are successful are sustained once that intensive investment of support and resourcing is perhaps lessened. So I want to leave it there and just sort of say again, if you are working in this space and you want more information or you've got things you'd love to share with us, we'd love to know through the Nourish Network. And thank you very much.
We do have a couple of moments if anyone has any questions that they'd like to put up. Your voice sounds so much better than mine. We do have a couple of moments for questions. Look at you, you've answered all of that.
Okay. I'm sorry, someone else. I just wanted to ask you, have I got a microphone coming? Or, no, sorry. Yep. It's me. Sorry, Rob. I could probably yell.
Thank you so much for that. That was just excellent. Do you think that there's a difference between sports clubs and health and schools?
Definitely. So I think it depends at what level you're thinking of sports clubs. Certainly the small local community sports club is really challenging. There's a lot of engagement and a lot of community and volunteer goodwill, but there's no resourcing. There's usually no electronic sales register, there's no resourcing with suppliers. So I think the initial support needed is great. So I think it has to be tailored, bespoke to the context. But I think the commitment is kind of higher because it comes from a community. So once the change is made, it's sustained.
So we start off small first. You start off small, show them, build it, and they will come.
I think so. And that sort of peer networking, like communities of practice, is something we're looking at in Victoria now. Like, how can you learn from each other? Yeah. Really and collective. So one of the biggest issues is supply, right? Like, where do we get the food from that's healthy? And so maybe in some local areas they're looking at kind of collective bargaining, basically. How do we get the same suppliers?
That's really clever.
Thanks so much, Anna. That was really great. Rob's question is a good segue to my question. You presented a lot of research which has been done in retail settings, in clubs and health services, and I just wanted to propose that a bit of research in the school setting would be really fantastic. I know that schools are also tricky and complex, having worked in that space for a while now, and people are really, really supportive of healthy food in schools, and we always talk about, case studies of great successes that we see in school Tuckshops, but getting some actual proper evidence behind that would be so fantastic.
Yeah, just a quick, I agree, and it's funny because when we got into this space, I sillily thought, well, schools are done. Lots of people work in schools and food, so we'll do the other bits, but I think you're completely right, and yeah, we're keen to support that.